It sounds so almost perfect, doesn't it? Medicare for all. Medicare for all. Bernie Sanders' call for single-payer health care. Medicare for all. Now, who the heck could oppose that? Let's discuss Medicare for all with Hadley Manning with the Independent Women's Forum. Hadley, thank you for joining me. So this Bernie Sanders notion of Medicare for all, thank God we finally have a group that came out today and took a look at how much this will actually cost, and it's astounding.
That's right. A study from the Mercatus Center shows that over the first 10 years, a single-payer health system in the United States, like Bernie Sanders desires, Medicare for all, would cost $32.6 trillion. That's with a capital T, trillion. And just to put that in perspective, because I think sometimes with 9 zeros behind it, these numbers kind of lose their scope. That would mean if we doubled all of the individual income taxes, doubled our corporate income taxes, we still wouldn't have enough money to pay for that kind of price tag. So we're talking serious cash here.
And Hadley, I want to make sure everybody heard exactly what you just said. 32 trillion with a T, trillion dollars over the course of 10 years. And as you said, doubling everybody's taxes wouldn't pay for it. Now, Bernie Sanders, I think, Hadley, has never done a cost analysis of this. I mean, are anybody on the left disputing these numbers?
No, in fact, I've never heard anyone dispute the numbers. There's another, new socialist in town, we might say, Alexandria Ocasio-Cortez, who's running for Congress, and she is someone who calls herself a socialist. She has a political debate often boils down to people on the left arguing in favor of people, saying, people need health care, and people on the right saying, well, it's just not practical. Look at the numbers, and we talk about money. People versus money is not a winning argument for people on the right. It's important for people to understand that single payer is just another word for only payer. And in another context, we'd call this a monopoly or a monopsony, where we don't have any choice anymore. So that would be the greatest cost, ultimately, of single payer.
Hadley, last question on the cost, and you're right. I mean, this is not just a matter of money, and you're right. Republicans shouldn't argue on that turf, but on the cost, Hadley, I mean, how would they pay for it?
Well, there might be some kind of transitional system. They say they want Medicare for all, but ultimately what they'd have to do is something closer to Medicaid for all. And we've seen this through the Affordable Care Act. Their attempt to expand Medicaid has been successful in some states because some states have adopted it. But successful, we ought to define that term. Medicaid, when it comes down to being shortchanged, this is ultimately who pays the price. It's the vulnerable, sick, it's the indigent poor, it's people who have traditionally qualified for Medicaid, because now we're seeing overcrowding in that program, and the federal government actually paying states more money to enroll new people who maybe aren't disabled, who are capable of working, who are working age people, who maybe have low incomes, but we do better by those people by lowering the cost of private health insurance plans. So we've got to pay attention to who's actually going to pay the bill, because I think people on the left would design their tax scheme to maybe tax higher income people more. But in a public health system, it's ultimately the people who don't have any other options, people on the lower income side of the scale, who end up trapped in those public systems.
So, Hadley, cost aside, Medicare for all, as romantic as that notion is, why is it such a bad idea? Forget about the money. It can't work. It won't work. It'll lead to poor health care. Why, if you were advising Republicans, how would you advise them to talk about this?
Well, I'd say we've got plenty of evidence. This month, actually, the National Health Service in the United Kingdom is celebrating 70 years. And this is really 70 years of evidence of why public health systems simply don't work. When there was an outbreak of the flu this past winter, a very common virus in the United Kingdom, they had to cancel 50,000 non-emergency surgeries, and patients are waiting hours and hours in their emergency rooms. There's overcrowding in the hospitals, hospital beds not enough for the people in the United Kingdom. And that's ultimately what happens when you have one public system. There's not a competition among actors who can say, hey, if you don't like the way the government's doing things, come over here. There's another option. We want to keep, a vibrant system of choice in the United States. And I'd say we've been moving in the wrong direction. We need to totally reverse course and go back to a system that's fueled by competition and choice and individual actors making choices for themselves.
And Hadley, this notion of single payer, ultimately it does lead to rationing of care, doesn't it?
Well, whether it's explicit rationing, for example, the government making a rule that if you're over a certain age, you no longer qualify for certain services and treatments, or implicit rationing, which is already happening today in the Medicaid program in the United States, because too many doctors say, hey, listen, I can't participate in this. The reimbursement is too slow. It's too low. I can't pay my overhead to see patients who are, being underfunded in the Medicaid program. Then there's not enough options for those people. They don't actually have real access to care. It's like giving someone a coupon for a free television, and yet none of the stores around are selling televisions. That's ultimately what Medicaid's doing, and it's what every public health system has to do, because there's ultimately no way to fulfill all the orders. There's insatiable demand for health care when it's free.
Hey, Hadley, as you look at this, where are we headed in healthcare in America? I mean, we're now how many years removed from Obamacare? The Republicans have whacked a little bit of Obamacare. This notion of Medicare for all has huge Democrat support. Where do you see our healthcare headed?
Well, it's so difficult for people who oppose single payer or some universal health system to articulate exactly what a so-called market-driven or free market health system would look like. But I would say let's look at other markets in the United States and where they're going. They're innovative, they're technology-driven, they're information-driven, they're focused on the individual consumer, they're full of options, competition, and choice. And we're starting to see around the fringes of American healthcare where more patients are opting into systems like direct primary care. These are innovative payment models that allow people direct access to their physicians. There is more competition among providers, for example, of different imaging services. And so as we begin to see those models become more popular, my hope is that people will understand that there's a different way to do this. We don't have to move towards a government-centric health system. We can move away from that to one that's driven by the private sector and that allows people the same type of customization and individual control that we see, for example, in smartphones or in other, markets that are driven by the private sector.
Hey, Hadley, great stuff. Thank you so much for joining me. I really do appreciate it.
Thanks for having me.
The Gallery of the Stupid coming right up.